Hi everyone, welcome back to my channel. In today's video, we will solve two questions related to CPT respiratory system. This is very important for your CPC exam study routine. To study guidelines related to cardiorespiratory system, you can check the playlist CPC exam cardiorespiratory series. The link will also be mentioned in the description. Let's start with the first question. We will use elimination method to solve this question. Let us check the first codes from each option. Check the code 31231. 31231 is for nasal endoscopy diagnostic, unilateral or bilateral. In option C, check the code 31235, that is for nasal sinus endoscopy diagnostic with sphenoid sinusoscopy via puncture of sphenoidal phase or cannulation of ostium. And option D, 31237 is for nasal sinus endoscopy surgical with biopsy, polypectomy or debridement. Now let us read the question and highlight the important terms. A patient with chronic sinus pain and swelling presented to the office for a diagnostic endoscopy of the nasal sinuses. During the procedure, the surgeon excised 2 polyps on the left sphenoid sinus. What is the correct code for this procedure? So which among these 4 codes is the right one? The right code is option D, 31237, because that is for nasal sinus endoscopy surgical with biopsy, polypectomy or debridement. Because in the question they have mentioned the surgeon excised 2 polyps on the left sphenoid sinus. We are going to eliminate option A and B because the first code is 31231, that is only for diagnostic endoscopy, not surgical. In the procedure, though they have mentioned the patient presented to the office for diagnostic endoscopy, during the procedure the surgeon excised 2 polyps on the left sphenoid sinus. Therefore, the diagnostic endoscopy was converted to surgical endoscopy. Therefore, we have to use the code 31237, that is for surgical endoscopy. The code 31235 describes only diagnostic endoscopy, so that is also wrong. The right answer is option D. Let us move on to the next question. Let us check the options first. Check option A, 31605, that is for tracheostomy emergency procedure, cricothyroid membrane. And in option B, the code 31600 is for tracheostomy planned separate procedure. Option C, no code would be used for the intubation. Option D, 31603, tracheostomy emergency procedure transtracheal. Now let us read the question. A 47-year-old male patient with advanced cancer of the left mandible presented to the hospital for surgical removal of the lower left jawbone with secondary insertion of mandibular prosthesis. In order to perform surgery, the patient had to be intubated through a tracheostomy. After anesthesia, the surgeon performed the tracheostomy by incising the cricothyroid membrane horizontally along the trachea and inserting the intubation device. The surgeon completed the primary surgical procedure of the patient's mandible. What is the correct code for intubation? So which among these 4 options is correct? The right option is C. No code would be used for the intubation. You may think the right answer is 31600, that is tracheostomy planned separate procedure. This code is designated as a separate procedure, right? So it should only be reported if it was the only procedure performed during the surgical session. In this case, the primary procedure performed was the mandibular excision and reconstruction. Therefore, the tracheostomy should be bundled into the major procedure. The intubation should not be reported separately. Therefore, option C is the right answer.